Hi, my name is Allison Stewart and I am doing the health assessment for Presentation College. This is my patient for today and we have already provided privacy by shutting the exam door. I'm going to be doing a head-to-toe assessment and we have already done a set of vitals before we came into the room, including blood pressure, temp, radial pulse, respirations, height, and weight. Everything was within normal limits. So we will begin. I've already gotten her name. I'm starting to do my general survey to check her level of consciousness, her mental status, her mood, her personal hygiene, her skin, her color, mobility, posture, her ability to speak, hear, understand what's being said to her. All of that did come back within normal limits. I'm going to go ahead and check throughout the whole exam. I will be looking at her skin, checking the color of the skin, looking for any bluish skin, or pink or pale. I'll be checking pigmentation, moisture, temperature, turgor, texture, lesions. I will be looking at all of that while going over the skin. I'm going to now start with the head and face. I'm going to inspect the scalp, looking for any lesions or anything abnormal. Looking through the hair and the cranium. I'm going to check her facial features for symmetry. I'm going to check her eyebrows, her nose, her mouth when she smiles or frowns to make sure there's no drooping. I'm going to palpate for any tenderness around her face and on her neck, palpating the lymph nodes behind her ears. I'm going to perform the whisper test. Baseball. And I'm going to perform the Weber test. I'm going to be using my imaginary tuning fork here. And I'm going to tap my tuning fork, place it on her head, and ask her to tell me where the sound is coming from.
All around.
Okay? And then I'm going to perform the rhyme test, where I'm going to again tap my tuning fork, and I'm going to place it on the mastoid process, and ask her to tell me when she stops hearing the noise.
Stopped.
Okay, then I'm going to note that down. I'm going to write that down, and then I'm going to move it by the ear canal and ask her to tell me when that stops again.
It stopped.
And then I'm going to go ahead and compare the two. I'm going to now move to use the otoscope, and I am going to look in her ear, pulling up and back to look in the ear canals, and I'm going to do that on both of her ears. I'm now going to move to her eyes. I'm going to do a vision exam. If you'll stand up for me, I'll have you cover up one eye, looking at the eye chart in front of you. Read me the lowest line.
E-A-L-F-J.
I'm going to have you cover up the other eye, and I'm going to have you do the same thing.
E-L-F-J.
And then I'm going to have you do both eyes. And again. No, using both eyes.
Oh.
The lowest line you can read.
E-L-F-J.
Alright, you can have a seat back down. I'm going to look at the eyelids, and I'm going to check the eyelashes. I'm going to look at the conjunctiva, the sclera, the cornea, and the iris. I'm going to check her pupil size and response to see if she's following the perla. The pupil is reactive. And I'm going to use the ophthalmoscope, which this is my pretend ophthalmoscope. And I'm going to check to see how her eyes respond to that. I'm going to check the visual fields by having you tell me when you can see my fingers.
No.
Okay? And then I'm going to do the extraocular muscular gaze, the sixth position. I'll have you follow my finger. Okay. And then I've already checked the corneal light with the reflex with my ophthalmoscope. And now I'm going to inspect the nose, the nasal structure, looking at the structure of her nose, the septum, the nares with the speculum, the mucosa, the septum, the turbinates. I'm going to check the patency of the nostril by plugging one nostril at a time. And I'm going to give her an object to identify the smell. Can you tell me what that is?
Coffee.
And now I'm going to move on to the mouth. I'm going to inspect her mouth and tonsils, checking the mobility of her uvula using my imaginary tongue blade. I'm going to have you open up your mouth and say ah. And I'm going to check the uvula at the same time. Everything looked normal. I am now going to check her neck and the trachea and make sure everything is in line. I'm also going to palpate for the thyroid gland, the carotid arteries, and the lymph nodes. I'm going to check muscle strength of her trapezoid and sternomastoids by having you pull your hands out there. Okay? Push against my hands and pull back. There you go. And I'm going to go ahead and next I'm going to do the circular or cervical range of motion. So I'm going to move your head. Are you having any pain?
No.
Any discomfort with that?
No.
Okay. And that was normal. I'm going to also be looking at her neck to see any jugular vein distension. I am going to check her carotid arteries. I'm going to now auscultate her carotid bruits by listening for that flushback sound. Okay, everything sounds normal. I'm going to now inspect the upper extremities. I'm going to first put an object in her hand, a couple of different objects, asking her to identify them. Have you open up your hand? Yep, close your eyes, thank you. Can you tell me what that is?
A pen.
Okay, and open up your hand again. And what is that?
An eraser.
Perfect. Okay, I am now going to do the graphithesia by drawing a number into her hand and having her tell me what number it is.
4. 7.
Perfect. Okay, I'm now going to look at her range of motion of her shoulder. And her elbow. And her wrists. And I'll have you wiggle your fingers. And I'm going to have her do that to both of her arms. Okay. I'm going to palpate for muscular strength in the shoulders and in the wrists and the elbows. I'm going to have you push back. Okay, I'll have you pull. All right. And the same thing with your hands and your fingers. Perfect. And then I'm also going to palpate for a radial pulse. 5, 4, 3, 2, 1. Oh. And then I'm going to also check for the other pulse up here too.
Brachial.
The brachial, thank you. And then I'm going to perform the finger movements, the rapidly alternating finger movements. So we'll go follow
5,
me. 4. Yep.
5, 4, 3, 2, 1, 1,
Yes.
2, 3, 4, 5, 4, 3, 2, 1, 1, 2, 3, 4.
Perfect. I'm going to perform the reflexes using my reflex hammer. Okay, I'm going to do the biceps and the triceps. Okay, and then also the brachyradialis. Perfect, and I would do that on both of her arms. I am now going to observe for any pain. Are you having any pain in either of your arms?
No.
Okay, no pain while I'm touching. Okay, all right. And I did that with a light touch and a deeper touch. I am now going to do the posterior chest. I'm going to have you probably come up here. I think that might be a little easier. Okay, I'll have you just turn around and sit up on the bed there for me. Thank you. Okay, so I'm going to, oh, I'm sorry, I'm going to have you stand up first.
Oh, sorry.
I'm going to have check the symmetry of the spinosis process by looking at her back and making sure it's in a straight line. I am then going to be palpating for any tenderness, bulges, tectoral expansion. I'm going to have her take a deep breath in, or thoracic expansion, thank you, and exhale. Okay, and then I'm going to do the tactile fremitus. I'm going to have you say 99 over and over again for me until I tell you to stop. Okay, go
99,
ahead.
99, 99, 99, 99.
Okay. And I'm going to now percuss the chest wall bilaterally.
No.
Okay, and then I'm going to check for any CVA tenderness. Any tenderness?
No.
Can I do any of that? Okay. And then I'm going to auscultate posterior and laterally the chest wall. Another deep breath. And again. And again. Okay, and then laterally. Thank you. Okay. And now I'm going to go to the interior or the anterior part of her chest, and I'm going to inspect the respiratory movement for looking for symmetry and retractions. Take a deep breath in for me. Okay, that all looks normal. I'm going to then, I also, while doing that, looked at the thoracic expansion. The tactile fremitus again, I would have her do the 99. Say 99.
99, 99, 99.
All right. And then I'm going to auscultate and listen to the anterior chest bilaterally. I'm also going to listen for the apical pulse. Have a deep breath in. Deep breath in. And again. And again. Okay, now I'm going to listen for the apical pulse. And I measured that for 30 seconds and times that by 2. I'm also going to listen to all sounds of the chambers of the heart with the valve 5 position. Okay. And then now I'm going to do the breast exam. So I'll have you go over on the other side there and we'll lay down. Now this was all done prior to coming into the room, but in a breast exam, you are going to have them lay with their arm above their head, and you're going to go around the entire breast, catching all the areas and feeling for any lumps or bumps. You're going to use a lighter touch and a deeper touch. Then you're going to go ahead after doing both of those breasts, you're going to check for the lymph nodes, the auxiliary lymph nodes, which are right in the armpit there, and you're going to do that on both arms. Now I'm going to move to the abdomen, where I'm going to inspect the contour and symmetry of the pulsations, the skin, the umbilicus. I'm going to make sure everything looks okay. Then I'm going to auscultate the abdomen, all 4 quadrants for the bowel sounds. Okay. And then I'm going to listen for the aorta brutus. Or the aorta bruits, actually. And then now I'm going to palpate all 4 quadrants using a light. And then I'm going to go deeper. Any pain or discomfort? No? Okay. And then I'm going to move on to the, or I'm going to percuss all 4 quadrants as well. And I'm listening for any masses. Now I'm going to move to the inguinal area, and I'm going to palpate the femoral pulse, which is going to be right in this area here. And I'm going to also check the inguinal lymph nodes, which are in that same area, the horizontal and vertical chain. If this was my male patient, I would have them, I would also be doing the testicular exam. For the lower extremities, I'm going to inspect the range of motion on the legs and the hip, the knees, the ankles, and the feet. So for the hip, I'm going to move her leg up, over, in, and then back down. For the knee, I'm going to go up, and then back down. And then the ankles, I'll have you roll your ankles. Okay. And then for the feet, I'm going to have you push and then pull back. Perfect. And I'm going to do that on both of the legs. That's also looking at their muscular strength and also checking for the range of motion. I'm going to also do the feel for the popliteal pulse. Okay. And I'm going to go for the tibial pulse, which you're going to find on the outside of the ankle there. And then the dorsus medialis on the top of the foot. I'm going to feel for that pulse as well. Okay. I'm going to perform reflexes rather. Yeah. We'll have you come, actually I'll have you just scoot to the other side of the bed there. And we're going to perform the popliteal reflexes. Alright. And now we're going to go ahead and the ankle reflexes, I'm sorry, I missed one there. Okay. And I'm going to do that on both of the legs again. I am going to ask her if she's having any pain. I'm going to feel on the legs, checking for any pain, any masses, things like that. Are you having any pain in either one of your legs? Okay, I'm going to have you stand up. So now we're going to do a coordination where we're going to run our heel down our tibia, okay, and onto the opposite leg. So, yep, exactly. And run your heel down, and then do the other leg. Okay. And now we're going to do the neurological. I'm going to watch you walk. So if you could go back to the door there and come towards me. Okay. And now I've monitored her gait. Now I'm going to have you go ahead and come back towards me, walking back heel to toe. Oops, sorry.
Oh, hold on.
We'll try that again. Okay. Yep. Perfect. Okay. And now I'm going to check the spine for the range of motion. By doing that, I'm going to have her bend over and touch her toes. And I can see that the spine is in alignment and that she is able to do that. Now I'm going to perform the Romberg test. And for that, I'm going to have you stand with your feet together. Okay, for about 10 seconds. Okay, then we're going to go to this position here for another 10 seconds. And then we're going to move to the heel to toe position and hold and stand there for another 10 seconds. Okay, and that would be completing my head to toe assessment for Presentation College. Before leaving the room, I would ask the patient if there was anything that they needed me to discuss with the doctor ahead of time, and I would go then and report any abnormal and normal findings to the physician and send them into the room. Thank you.